Today we will discuss about introduction of thorax. Thorax consists of sternum, vertebral column and ribs. Thorax is bounded anteriorly with sternum, posteriorly with vertebral column and on each side by ribs. There are total 12 ribs, first 7 ribs articulate with sternum with the help of cartilages. These are called vertebrosternal ribs. These are also called true ribs. 8th, 9th, 10th rib articulate with next higher cartilage with the sternum. They form costal margin. They are called vertebrocondral ribs. 11th, 12th rib have free anterior ends. They are called floating ribs or vertebral ribs. Each rib articulate posteriorly with vertebrae and anteriorly with sternum. 11th, 12th rib have free anterior end. They do not articulate anteriorly with sternum. Shape of thorax. Shape of thorax is narrow above and wider below. If transverse section of human adults is taken, thorax resembles to kidney shape. In infants, transverse section of thorax is circular. In quadrupeds, anteroposterior diameter of thorax is greater as compared to transverse diameter. In human adults, transverse diameter of thorax is kidney shape. In infants, it is circular. In quadrupeds, anteroposterior diameter is greater as compared to transverse diameter. Again, shape of thorax. In human adult, transverse diameter of thorax is greater as compared to anteroposterior diameter. In infants, anteroposterior diameter and transverse diameter are nearly equal. In quadrupeds, anteroposterior diameter is greater as compared to transverse diameter. Thoracic inlet or superior thoracic aperture is basically upper end of the thorax which is continuous with the neck. Thoracic inlet is bounded anteriorly by upper border of manubrium sternum, posteriorly by superior surface of first thoracic rib, and on each side by first rib. Plane of inlet is directed downward and forward, making an angle of 45 degrees. Anterior part of inlet is below as compared to that of posterior part. Upper border of manubrium sternum lies at the level of third thoracic vertebrae. Thoracic inlet is separated from the neck by a suprapleural membrane. Suprapleural membrane is present on each side of thoracic inlet. Suprapleural membrane is basically a flattened tendon of scalene minimus muscle. It is triangular in shape, with apex attached to the transverse process of 7th cervical vertebrae and base attached to the lower border or inner border of first rib and its costal cartilage. Suprapleural membrane basically provides rigidity to the root of neck. Inferior surface of suprapleural membrane fuses with the apex of lung or pleura of lung. Superior surface is related to subclavian artery, subclavian vein. There are various structures passing through the inlet of thorax like viscera, large vessels, small vessels, nerves and muscles. We will discuss one by one each of them. This is cross-sectional view of thoracic inlet. There are various structures that pass through thoracic inlet. First of all, we will cover various viscera like trachea, esophagus, apex of lung, and thymus. Some large vessels like brachiocephalic artery, left common carotid artery, left subclavian artery. These are the branches of arch of aorta. Right and left subclavian veins or brachiocephalic vein. Small vessels like superior intercostal artery, first posterior intercostal vein, left internal thoracic artery, right internal thoracic artery, as well as inferior thyroid veins. Nerves like first thoracic nerve, sympathetic chain, phrenic nerve, vagus nerve. Some muscles like longus colli, sternohyoid and sternothyroid muscles. Trachea, esophagus, apex of lung. These are the viscera seen passing through the inlet of the thorax. Large vessels which are seen passing through thoracic inlet are brachiocephalic artery, left common carotid artery, left subclavian artery, which are the branches of the arch of aorta, and right and left brachiocephalic veins. This diagram shows some small vessels passing through thoracic inlet like internal thoracic artery, which is a branch of subclavian artery, superior intercostal artery, which is a branch of costocervical trunk. Costocervical trunk itself is a branch of subclavian artery. First posterior intercostal vein. Posterior intercostal veins drains into brachiocephalic vein, and inferior thyroid vein itself also drains into the brachiocephalic vein. Muscles which are seen at the level of thoracic inlet are longus colli muscle, sternohyoid muscle, as well as sternothyroid muscle. Longus colli muscle basically originates from C5 to T3 vertebrae and is inserted on atlas vertebrae, which is first cervical vertebrae. Sternothyroid muscle originates from posterior surface of manubrium sternum, and this muscle is inserted on thyroid cartilage. Sternohyoid muscle, as the name tells, originate from posterior surface of manubrium sternum and is inserted on hyoid bone.